the reason people need to talk is because once you start talking, you know how much it helps. And I'm not saying this just as a psychologist. I'm saying this as someone who's been in therapy myself. As a part of your training, you have to take a few sessions. So I started 2 years ago and I couldn't stop because it really helped. And when you start talking, you do not know what you're going to say. And what ends up happening is you end up talking about things that really affect you, things that you would never speak about, but you end up disclosing it. You end up talking about it. And the sweet relief and how light you feel sharing that with someone is what really helps. And people who are struggling with a terminal illness, most times than not, want to talk about it because they are there's so much uncertainty, there's so much fear, that it really helps to let them out. But what ends up happening is family members kind of try and shield them, protect them. I know this because I've seen this, where family members have said, oh, we don't want you to talk to them about cancer because we haven't even told them that they have cancer. And I'm sitting there thinking, they're in a cancer hospital. They're looking at everybody else go through treatment. They're looking at what's happening around. Do you think they're not aware of what's happening? And you trying to shield them is going to get their anxiety even more up rather than down. Totally understandable. You want to protect them. You care a lot about them. But that is not the way to, I feel like what happens most of the time is people are really scared themselves when it comes to that sense of, am I going to lose this person? So it's in their effort to, deal or grapple with that. They feel like I need to focus on taking care of my family members. So if I don't think about these things, I'll be fine. So they feel like if this is helping me, it'll help the other person who's actually suffering with cancer. But that's not what happens. So talking to someone really relieves their anxiety. In any case, if someone's going through something really difficult, we know as psychologists and mental health professionals that it takes more energy to not feel something than to actually feel it through and talk about it. So you're spending a lot of your mental and psychological energy in trying and keeping something to yourself and not thinking about it or feeling it, than when you are actually speaking. When you speak it out, when you share it, you release all of that built up tension, anxiety, and it's way more healing than keeping it locked.